The U.S. Surgeon General has declared a national health crisis, warning that gun violence, and let me quote this, poses a serious threat to the health and well being of our country. He also is calling for an evidence based approach to doing research to figuring out how we can do better. Wherever people stand on this issue of guns, I think we can all at least agree we have a problem. So let's talk about it. Hey everybody, it's Dr. David, a board certified pediatrician in Tampa, Florida. I've one who have always support individual rights to do things that are legal, and hopefully that people are making wise decisions and doing things to make sure that things are safe, that things are done properly. And right now in America, we have a big time problem when it comes to gun violence. Okay. Now, up front, as a very transparent person, I do not own a gun. I've never shot a gun except for the little pellet gun at Disney World many years ago. But also, I would love to see a world that existed with no guns whatsoever. Okay, but I also realize that there will be guns. There always will be guns. It's part of the foundation of our country, and I respect that. Okay, but also, as I've always said, it's your health, it's your choice. You can decide to do what you wish to do, and gosh darn it, I hope it's being done safely. Okay, so now what has just happened? The U.S. Surgeon General issued a public advisory, a public warning. And his name is Dr. Vivek Murthy. If you don't know, he warned that gun violence, again, that it poses a serious threat that has not just a serious physical toll, but a mental toll as well. Now, to be clear, while there are recommendations in there, there was no mention about taking away people's guns, banning guns, or anything like that. I realize in this hyper partisan world and the fact that this is coming from a Democratic administration, Surgeon General, that immediately people will jump on this as who the source is and everything like that. But just to be clear, that was not part of this warning here. This is just pointing out the simple truths of what we're saying, which we're going to get into some statistics in a little while. And also potentially just some ways that we can maybe move forward and make this not be as much of a problem. Okay. Now, in his statement, he actually spoke a little bit about his own personal experience, saying, "As a doctor, I've seen the consequences of firearm violence up close in the lives of patients I've cared for over the year. Over the years, there are moms and dads, sons and daughters, all of whom were robbed of their physical mental health by senseless acts of violence. Now, just recently, I saw a patient who was seeking my help for natural pain relief, as well as for anxiety control from a gunshot wound that he had experienced in his own neighborhood. Okay, happened a little while ago. This wasn't an acute injury, but he has ongoing psychological trauma. He has ongoing physical injury that has to be dealt with. Okay, and hopefully the medical plan that we put forth will help him out with that. But also, it was something that maybe in a different world or other circumstances, it wouldn't have happened in the first place. Okay, so in the Surgeon General's warning, he also did call for evidence-based public healthcare approach. So evidence means based means doing research, not just making a random flippant based upon a person's whim or a person's philosophy, but doing proper research. Okay, in order to find, and by a public health approach, it doesn't mean we're going into everybody's home to talk about this, but a public healthcare approach. Things like what got us to the point of recognizing that cigarettes is a serious problem. Okay, that got us to the point of wearing seatbelts in cars. That was a public healthcare emergency. People were dying in car accidents. Just by implementing seatbelts, we caused a significant reduction. So those are public healthcare policies, different than private healthcare policies, which is not the business of the government. But these are general warnings, advisories, etc., that is put forth. And so what he really was focusing on was five different things. Reducing, and first of all, to just reduce and prevent firearm-related death and injury. Okay, wonderful, noble cause. And yes, increasing the research investments and as well as the data collection. There's good ways of collecting data. There's bad ways of collecting data. We want to make sure that we're not getting junk science. We're not getting junk garbage data. We have to make sure that the way that the data is collected is fair, accurate, stored properly, not able to be tinkered with, so that we can really get some good answers to see how can we help out the situation. Also, to implement risk reduction strategies. Whenever I am doing a checkup with somebody, I don't. I ask if I first start off by saying I'm going to ask this question from a safety perspective. Do you have any guns in the home? Okay, this isn't a judgment question. This isn't a telling them to get rid of them. My follow-up question, if there is how are you storing them? Again, remember, as a pediatrician, I'm dealing with kids in the home. Of course, it's a fair question for anybody, because maybe have cousins or aunts, or nieces and nephews or grandkids in the house. But as a pediatrician, I'm asking a parent, is there any guns in the house? How are you storing it? Okay, and I will tell you this: through the years, I have occasionally heard some rather amazing responses, such as, it's under the pillow, or it's in the nightstand. And these are people who are co-sleeping. Okay. So when I talk to them, I even talk to them about, a lot of them have a safe. What kind of safe do you have? If you're trying to get access to your gun in the case of emergency, are you trying to deal with a knob or you're trying to rotate back and forth? Are you able to quickly get to it through a fingerprint or through a retinal scanner? So again, we're not telling people don't have it. In fact, I'm advising people how to make sure that they can get and use their safe properly if they actually need to use their gun. Okay. Um, but also community-based intervention and education programs. Okay, a lot of people don't know these types of things. Okay, a lot of people don't know that there are maybe safe ways to store it, such as having the clip or the bullets not be in the gun, having them stored in two different places. Okay, so that someone can't just accidentally grab it and fire it. Okay, I mean, there are things like education like that to know. Okay, but also to encourage healthcare systems to talk with patients during routine medical events, just like what I do. And there's also, again, for this, so that security of the storage. I mean, it's so important to know how to do this safely. I know so many people who are members of the National Rifle Association and gun owners who are really amazingly good at teaching their children proper safety, storing, and all of these things like that. That's what I want to make sure. If you're going to take your child hunting with you, if you're going to take him to the gun range, are you educating them in such a way to do this as safe as possible? That, of course, these aren't toys, right? When we used to run around when we were little kids with fake guns, they were toys. We want to make sure that kids know these aren't toys. Okay. Now, in terms of some of the statistics, and this is, I think, the reason why that this has come up. Now, everything that I'm mentioning, this is quoted in the advisory. The link to it is in the show description, so you can see it yourself. But since 2020, the number one cause of death among children and adolescents is gun violence. Okay, it has now surpassed car accidents, drug overdoses, and cancer. The number one cause of death of children is gun violence. Now, as far as the firearm related deaths overall, we are now, and the last statistic that I had was from 2021, a 3-decade high in terms of just firearm related deaths overall. And this has been driven in a spike of homicides and firearm suicides, even more so than accidents. Okay. In 2022, there were 48,000 people who died from firearm related injuries. 56% of them were suicide. Okay. So this was somebody who had access to a gun, who then did the ultimate thing because of mental health issues that they have. How can we identify people who have mental health issues? How can we get them the help that they need to take away their depression or their anxiety, or potentially even thoughts in their head, hearing voices that tell them to do this? This is as much of a mental health a mental health crisis as well as anything else. Okay, so if we can identify who the people are, of course, that would be a very hopeful thing. But also 40% of them were from homicide. So it's not just suicide that this is happening from. And in fact, right there, that makes up 96% of all guns. The accidents is a very small percent. Okay, now impact on people itself, not the person who, God forbid, was shot or killed. Okay, 54% of U.S. adults say that they or a family member have experienced a firearm related incident. And that could be a personal threat or injury by a firearm. They may have been the shooter, whether it was accidental or intentional, or they witnessed the shooting. But that's more than half of us have dealt with this firsthand. Now, in terms of even some of the mental and emotional ramifications of gun violence, so half of U.S. teens, so the ages 14 through 17 in particular, say that they worry about a shooting at their school or a nearby school. Now, mothers who witnessed at least one shooting in their community, they were 60% more likely, or that I not necessarily witnessed firsthand, but it happened in their community, 60% more likely to meet the criteria for depression than if it wasn't part of their community. Of course, if it was a friends in your school, if you knew somebody, of course, that's going to have more of an impact. Now, siblings of children or adolescents who died from firearms, okay, they do exhibit a 2.5-fold increase in psychiatric disorders after that happened. Okay. Now, if the mothers of children who've died from firearms exhibit a 3.5-fold increase in those mental health issues, which of course makes sense, fathers even more so, 5.3 times more likely if there was a family member, if there was something close to them that had from a firearm injury, and that's all in the advisory as well. So it has a very significant impact. Of course, let's face it. Of course, if God forbid somebody you knew died from a gunshot wound, it's with you for life. That leaves a mark. Of course, it will. How could it not? Some people obviously are able to get past it, but a lot of people go into chronic mental health issues. Okay, now, in terms of this concept of taking a public approach, okay, so in terms of tackling gun violence from a public healthcare perspective, but of course, we still need to be able to respect people's rights, right? And as I said, whether it's cigarette smoking, whether it's motor vehicle deaths, we have made a difference with those things. People said it couldn't be done. People won't wear seatbelts. People wear seatbelts. Let's face it, cigarette smoke. The number of people who are smoking cigarettes, buying cigarettes, teen youth of cigarettes, way down. Why? Because education. It didn't happen overnight. It didn't happen overnight. But even in my practice, when I ask families, is anybody smoke around the child, or do you smoke? I don't know. Like, rarely ever does somebody answer yes to that question at all. I can tell you that when I started doing this job 25 years ago, it was very, very different. Okay, now another part of this that they called for within the advisory was encouraging legislators, policymakers, legislators, executive branch, to pass common sense gun reform. And I realize that this is what's going to probably ruffle some people's feathers, but this is in the report, and I'm wanting to present everything that was there. Okay, and again, some of this, right? Make sure that there's safe storage. Make safes more available to people. Maybe even make gun safes the type of thing where it's only available with those quick access types of things. Maybe the government can pass laws that for people who can't afford it, we can give them discounts or give them gun safes so that they can be safe with and still have a gun in their house. Universal background checks. We've talked about this. This has been a thing that's been part of our country. The overwhelming majority of NRA people believe that there should be a universal background checks and of course, getting rid of the loopholes that can make that be not really workable. And now, again, one of the things called for was a ban of assault weapons, of large capacity magazines. I know that bump stocks were just ruled to be a ban on bump stocks was ruled to be unconstitutional. Hey, the law is the law. The Supreme Court has spoken. Of course, there can be laws that can be passed to change that. The bump stock law was something that was passed under the Trump administration. It was something that he was supportive of. So, this isn't necessarily a conservative versus progressive type of thing. This is about safety. That was a consensus thing that happened. And of course, increasing mental health care, passing laws to make sure that mental health is recognized as human health issues, right? Making sure that there are more therapists out there, that there are people who are able to do the screenings, that in public health, in clinics and other places where these types of screenings can take place. Okay, but also, and again, recognizing against the controversy of removing of effective firearm removal policies, such as under extreme risk of protection. So obviously, if somebody's been threatening somebody with a gun, can the government step in, and can the legal system step in and say, hey, you're threatening somebody with a gun, you don't get access to it. People who have serious mental health, people who are hearing voices, again, telling them that they should go shoot somebody or shoot themselves, should those people be allowed to be carrying, to be gun owners, gun possessions, at least until that's worked out. But also domestic violence. We know that that's an issue, that within domestic violence, within restraining orders and things like that, if somebody's threatening a spouse or a domestic partner with a gun, should those people, especially if there's been other violence, be allowed to keep guns? And again, that's something that needs to be figured out. That's something that needs to be researched, something that needs to be understood. But let's face it, not everybody, even though the overwhelming majority of gun owners do things safely and would never think of something like this, it does happen. It needs to be addressed. So in terms of what are my thoughts? So first of all, I realize that gun advocates, some of them even having this conversation, not only be uncomfortable, it's crossing a line. I get it. Guns can be sacrosanct for some people. It's part of their family, part of their heritage, part of everything. And I totally get that. Okay. But again, we have a problem. And the thing is this is largely a problem here in America. In 2022, the rate of firearm deaths in the United States was 26 times higher than the average of all of the other high-income countries in the world. 26 times more gun deaths. That's amazing. Sad, but it's amazing. Okay. So I am very glad that the Surgeon General made this warning. I am fully believing that more research needs to be done on this. But again, we need to define what the real issues are. Okay. Not every single thing that I mentioned is actually the thing that'll help. But if we don't look at it, we're not going to figure that out. So really, I would love it if we can focus on solutions. Because if we can do that, then the fewer of our loved ones, such as the 50% of Americans who have dealt with this, but the few of our relatives, our loved ones, maybe there won't be as many people who die. And I think that that's important. So, yeah, it'd be nice if we could forget the politics on this one, if we can forget the partisan on one, and just do common sense laws, policies that can make a difference. Have a nice day.